Addressing the rise of health-related misinformation, Minister Luvindao drew attention to how social media and unverified sources have misled the public on topics such as vaccination and diseases. The minister cited the ongoing debate around the HPV vaccine, which helps prevent cervical cancer, a leading cause of death among women in Namibia. Despite scientific consensus on its effectiveness, uptake remains slow due to misinformation. Dr. Luvindao further clarified that no vaccine or immunization is mandatory in Namibia.
Vaccines at this point, I wish to highlight, are one of the most effective tools we have to prevent infectious diseases. It is sad to note that it is a preventable disease, yet one that we continue to diagnose people with. I also wish to highlight, as I highlighted on TV a few days ago during a live interview, stating that it is important for us to understand that cervical cancer is still largely a disease of inequality. A lot of the times, the people that debate on this issue are the ones sitting in the towns and the cities, and those that are oftentimes largely affected are the ones in the rural areas. And they are affected largely by the misinformation and unable to make decisions for themselves.
Dr. Luvindao further reiterated the government's commitment to decentralize healthcare, announcing a target to expand the country's community health workforce to 10,000. This expanded team will be educating communities on essential health principles and ensuring that all Namibians can access the care they need. She also emphasized the importance of establishing health posts, a policy initially championed by the former Minister of Health, Dr. Kalumbi Shangula.
Recognizing, however, the critical need to strengthen our health workforce, the government of Namibia has approved a significant expansion of our staff establishment with the creation of 11,742 new positions earmarked to be filled. This brings the new total approved staff establishment of the ministry to 31,408 positions. However, despite this achievement, the reality is currently only 50% of these approved positions are filled. That highlights the fact that we are currently functioning at about 50% only staff complement, which definitely imposes a significant challenge and impact on the ground. It leads to increased workload for existing staff, longer waiting time for patients, reduced quality of care, uneven distribution of services.
The ministry reaffirmed to strengthen the country's health system and improve outcomes for all citizens. Siamantikwa, NBC News.